This morning I spoke with the leaders of the G7 nations, and they really had a good meeting. I think it was a very, very productive meeting. I also spoke with our nation's governors. And this afternoon we're announcing new guidelines for every American to follow over the next 15 days as we combat the virus. Each and every one of us has a critical role to play in stopping the spread and transmission of the virus. We did this today. This was done by a lot of very talented people, some of whom are standing with me, and that's available. And Dr. Birx will be speaking about that in just a few minutes. It's important for the young and healthy people to understand that while they may experience milder symptoms, they can easily spread this virus, and they will spread it indeed, putting countless others in harm's way. We especially worry about our senior citizens. The White House Task Force meets every day and continually updates guidelines based on the fast-evolving situation that this has become all over the world. It's all over the world. It's incredible what's happened in such a short period of time. On the guidelines of the task force, the new modeling conducted by Dr. Birx, and our consultation with governors, we've made the decision to further toughen the guidelines and blunt the infection now. We'd much rather be ahead of the curve than behind it, and that's what we are. Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation, and we will defeat the virus, and we're going to have a big celebration all together. With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made. I'm also pleased to report today that a vaccine candidate has begun the phase 1 clinical trial. This is one of the fastest vaccine development launches in history, not even close. We're also racing to develop antiviral therapies and other treatments, and we've had some promising results, early results, but promising, to reduce the severity and the duration of the symptoms. And I have to say that our government is prepared to do whatever it takes. Whatever it takes, we're doing. We're doing it in every way. And with that, I'd like to just introduce Dr. Birx, who's going to discuss some of the things that we strongly recommend. Thank you.
Thank you, Mr. President. I think you know over the last months we've taken very bold action to stop the virus from coming to our shores. And because of that, we gained time to really get together and understand the progress across the globe of what has worked and what hasn't worked. We now need to appeal to every single American so that they can have their role in stopping the spread of this virus. We've talked about things before about washing your hands, but we really want to focus on, if you are sick, no matter who you are, please stay home. If someone in your household is diagnosed with this virus, the entire household should quarantine in the house to prevent spread of the virus to others. The reason we're taking these strong and bold steps is because we know there is virus spread before you develop symptoms, and then we know that there's a large group, we don't know the precise percent yet, that actually is asymptomatic or has such mild cases that they continue to spread the virus. If your children are sick, please keep them home. Now, to our older population or those with pre-existing medical conditions, everyone in the household needs to focus on protecting them. Everyone in the household. I want to speak particularly to our largest generation now, our millennials. I have the mom of 2 wonderful millennial young women who are bright and hardworking, and I will tell you what I told to them. They are the core group that will stop this virus. They are the group that communicates successfully, independent of picking up a phone. They intuitively know how to contact each other without being in large social gatherings. We're asking all of them to hold their gatherings to under 10 people, not just in bars and restaurants, but in homes. We really want people to be separated at this time, to be able to address this virus comprehensively that we cannot see, for which we don't have a vaccine or a therapeutic. The only thing we have right now is the amazing ingenuity and compassion of the American people. We're appealing to all Americans to take these steps, to protect each other, and to ensure that the virus doesn't spread. These guidelines are very specific, they're very detailed. They will only work if every American takes this together to heart and responds as one nation and one people to stop the spread of this virus. Thank you.
Thank you very much, Dr. Birx. So just to connect with what I mentioned to you in previous discussions in this room, and Dr. Birx said it very well, that in order to be able to contain and curtail this epidemic to not reach its maximum capability, we have a two-pillar approach, one of which I believe has been very effective in preventing the substantial seating, and namely the travel restrictions that we've discussed many times in this room. The other, equally, if not more important, is when you have infection in your own country, which we do. And, you know, I could read the numbers, but they're really essentially what we've seen yesterday, incremental increases both globally as well as in the United States, with the curve doing that. So therefore, the kinds of things that we do are containment and mitigation. What we're mentioning now, the guidelines, when you look at them carefully, I believe if the people in the United States take them seriously, because they were based on some rather serious consideration back and forth. Some may look at them and say they're going to be really inconvenient for people. Some will look and say, well, maybe we've gone a little bit too far. They were well thought out. And the thing that I want to re-emphasize, and I'll say it over and over again, when you're dealing with an emerging infectious diseases outbreak, you are always behind where you think you are if you think that today reflects where you really are. That's not word speak. It means if you think you're here, you're really here because you're only getting the results. Therefore, it will always seem that the best way to address it would to be doing something that looks like it might be an overreaction. It isn't an overreaction. It's a reaction that we feel is commensurate, which is actually going on in reality. So take a look at the guidelines, read them carefully, and we hope that the people of the United States will take them very seriously, because they will fail if people don't adhere to them. We have to have, as a whole country, cooperate and collaborate to make sure these get done. Thank you.
Okay, go ahead.
Mr. President, a lot of people are concerned about how long all of this might last. Do you have any kind of estimate that if Americans really were to band together and do what the White House is suggesting, how quickly you could turn this corner?
My favorite question, I ask it all the time. How many times, Anthony? I think I ask him that question every day, and I speak to Deborah, I speak to a lot of them. I get the opinion. So it seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July, August, something like that. So it could be right in that period of time where I say it washes through. Other people don't like that term, but where it washes through.
So is this the new normal until the height of the summer?
We'll see what happens, but they think August, could be July, could be longer than that. But I've asked that question many, many times. Yes.
That being said, Mr. President, Americans today and looking forward are living with so much anxiety and so much fear, facing uncertainty right now. I'm curious, how are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
No, I think they are very scared. I think they see that we're doing a very professional job. We've been working with the governors and frankly, the mayors, local government at every level. We have FEMA totally involved. FEMA has been Usually we see FEMA for the hurricanes and the tornadoes. Now we have FEMA involved in this. They've been doing a fantastic job locally, working with people that they know because they work, like as an example, in California, in the state of Washington. They work with them a lot on other things, and they're very familiar, so they're working on it. What you can do, and all you can do, is professional, totally competent. We have the best people in the world. We have really the greatest experts in the world. And someday soon, hopefully it'll end, and we'll be back to where it was. But this came up. It came up so suddenly. Look, you were surprised. We were all surprised. We heard about it. We heard about reports from China that something was happening, and all of a sudden, we did make a good decision. We closed our borders to China very quickly, very rapidly. Otherwise we'd be in a very, as Tony has said numerous times, we'd be in a very bad position, much worse than we would be right now. You look at what's happening in other countries. Italy's having a very hard time. But I think that what we do, and I've spoken actually with my son. He says, "How bad is this?" It's bad. It's bad. But we're going to be hopefully a best case, not a worst case, and that's what we're working for. Yes.
You can clear up some confusion on two key fronts. One is about your own test. The other is about containment efforts. Is the administration considering more aggressive containment options, like a quarantine, a national curfew, restricting
Well, we have that very much. Yeah, we have that very much, and we've been pretty aggressive. We were early with Europe, but we were very, very early with China and other places, and fortunately we were. And as far as containment here, we're coming out with strong suggestions. And, it's becoming a little bit automatic. You look at people, they're not doing certain things. For instance, they're obviously not, I wouldn't say the restaurant business is booming, and bars and grills and all. People are self-containing to a large extent. We look forward to the day when we can get back to normal.
To be specific,
what's your second question?
are you considering instituting a nationwide lockdown, a nationwide quarantine? The NSC knocked that down, but there's still some questions about how it all came
At this
to be.
point, not nationwide, but there are some places in our nation that are not very affected at all. But we may look at certain areas, certain hotspots, as they call them. We'll be looking at that, but at this moment, no, we're not.
The second question is, you said you had your coronavirus test Friday night. The White House doctor's office put out a statement around midnight Friday saying that no test was indicated. So when exactly was your test administered?
Well, I had my test. It was late Friday night, and the reason I did it was because I had no symptoms whatsoever. So the doctor said, "You have no symptoms, so we don't see any reason." But when I did the press conference on Friday, everybody was going crazy. Did you do the test? Did you do the test? So very late on Friday night, I did the test. And he may have put out, or the doctor may have put out something I don't know what time the letter went out. Maybe it was put out by somebody else. But the results came back, I believe, the following day. And we tested negative.
But the question is, how could the White House doctor's office say a test wasn't indicated, implying that you hadn't had one when in fact you had?
Well, I told them that, and I went totally by what they said, the doctors, more than one. They said you don't have any of the symptoms. They checked what you're supposed to check, and that I didn't have symptoms. But I did a test late on Friday night, and it came back probably 24 hours later or something. They sent it to the labs, came back later. Yeah, please.
Mr. President, you had a teleconference with the nation's governors today.
Yeah.
And in that teleconference, you told them if they need things like respirators or masks to try to get it on their own. What did you mean by that, and what will the federal
If they can
government
get
do to
them
help?
faster by getting them on their own, in other words, go through a supply chain that they may have, because the governors, during normal times, the governors buy a lot of things, not necessarily through federal government. If they're able to get ventilators, respirators, if they're able to get certain things without having to go through the longer process of federal government. We have stockpiles now, and we're ordering tremendous numbers of ventilators, respirators, masks, and they're ordered, and they're coming, and we have quite a few at this point. I think, Mike, we have a lot. But if they can get them directly, it's always going to be faster if they can get them directly, if they need them. And I've given them authorization to order directly. Go ahead, please.
Mr. President, one of the big weaknesses in our healthcare system is surge capacity for medical facilities. And I wanted to ask what precautions, what planning is being done to get China was able to build hospitals in a matter of days. Are you prepared to use the Corps of Engineers or FEMA to start building surge capacity that we may need in a couple weeks?
Well, first of all, we hope we don't get there, and that's what we're doing, and that's why we're taking a very strict look at this. But we also are looking at areas, and not only looking, we're expanding certain areas. We're taking over buildings that aren't used. We're doing a lot in that regard. We hope we don't have to get there, but we are doing a lot in that regard.
Could you clarify something? These guidelines say stay home if you're sick. Yesterday, the Vice President said no one should worry about losing a paycheck if they stay home when they're sick. But the House bill exempts companies of 500 employees or more from the paid sick leave requirement, and that's 54% of the American workplace. Why is it a good idea to only require small businesses to provide paid sick
Well, we're
leave?
looking at that, and we may be expanding that. We are looking at that. We want fairness. We want it for everybody. No, we're looking at that through the Senate, because as you know, the Senate is now digesting that bill. So we may very well be adding something on that. Okay? Good question.
Two questions for you, Mr. President. One, going off of what he was asking, how many ventilators and how many ICU beds do we have right now, and will it be enough?
I could get back to you with that number. We've ordered a lot. We have quite a few, but it may not be enough. And if it's not enough, we will have it by the time we need it. Hopefully, we won't need them.
And you'll give us the exact number?
Yeah, we'll be able to
Because
give
so far,
you.
they have not given us an exact
Well,
number.
we can give you a number. If it's important, we'll give you a number. Go ahead.
And yesterday, you said that this was under tremendous control. Do you want to revisit that statement if we are going to be experiencing this until July or August, 5 more months ahead of right where we are
When I'm
now?
talking about control, I'm saying we are doing a very good job within the confines of what we're dealing with. We're doing a very good job. There's been a tremendous amount of the way they're working together. They're working hand in hand. I think they're doing really a great job. And from that standpoint, that's what I was referring to.
But
Yes,
it's not
go ahead.
you're not saying it's under control, right?
I'm not referring to it, meaning the. Yeah, if you're talking about the virus, no, that's not under control for any place in the world. I think I read.
You had said it
I
was,
think
so I
I
just
read.
wanted to
No, I didn't. I was talking about what we're doing is under control, but I'm not talking about the virus. Yes, please.
The stock market took another hit today. Is the U.S. economy heading into a recession?
Well, it may be. We're not thinking in terms of recession. We're thinking in terms of the virus. Once we stop, I think there's a tremendous pent-up demand, both in terms of the stock market and in terms of the economy. And once this goes away, once it goes through and we're done with it, I think you're going to see a tremendous surge.
Are you looking at any domestic travel restrictions? I know that's been on the table before, but is that firming up at all?
We're not really. We hope we don't have to, Steve. We think that hopefully we won't have to do that, but it's certainly something that we talk about every day. We haven't made that decision.
Mr. President, can I ask you, doctors and nurses in this country are telling us across the board that they're terrified of this virus, of the fact that they might get it, of the fact that they might take it home to their families. What can you say to assure healthcare providers in this country that the federal government is doing something today to ensure that they get personal protective equipment to protect themselves and their families?
Well, I think the federal government is doing everything that we can possibly do. We made some very good early decisions by keeping people out, by keeping countries out, certain countries where the infection was very immense. I notice a lot of people are talking about South Korea because they've done a good job on one side, but on the other side, tremendous problems at the beginning. They had tremendous problems and great numbers of death. I think that we've done a fantastic job from just about every standpoint. With that being said, you look, no matter where you look, this is something, it's an invisible enemy. And, but we are speaking all the time, not only with the people, but also the professional people, the nurses, the doctors. They have been doing a fantastic job. We are also working very much on getting them the kind of equipment that they need. And for the most part, they either have it or they will be getting it. But remember this, we want the governors, we want the mayors, we want them locally from a local standpoint because it can go quicker. We want them to work. And we had a great talk with the governors today. I think it was a really great talk. There's a tremendous coordination. There's a tremendous spirit that we have together with the governors. And that's pretty much, for the most part, bipartisan. Yeah.
Mr. President, you told John that you think this could wash through, as you said, July, August. You just told Steve when he asked you about a possibility of recession, you said it may be. I'm curious, if there is a recession, when do you think that might hit?
Well, I don't number one, determine recession. I just say this. We have an invisible enemy. We have a problem that a month ago nobody ever thought about. Nobody in the, I've read about it. I read about many years ago, 1917, 1918. I've seen all of the different the different problems similar to this that we've had. This is a bad one. This is a very bad one. This is bad in the sense that it's so contagious. It's just so contagious, sort of record-setting type contagion. And the good part is the young people they do very well, and healthy people do very well. Very, very bad for older people, especially older people with problems. My focus is really on getting rid of this problem, this virus problem. Once we do that, everything else is going to fall into place. Yes, please.
A lot of rumors last night that you were going to put in a national curfew or some kind of, texting
I've been
stuff.
reading, I've been watching.
Right, yeah, exactly. Me too. Your people were saying this is a foreign disinformation campaign. Is that what's going on? Are people messing with us on the internet?
Well, I don't know. I mean, that I can't tell you if they are or not. And, I think a lot of the media actually has been very fair. I think people are pulling together on this. I really think the media has been very fair. I think it could be that you have some foreign groups that are playing games, but it doesn't matter. We haven't really determined to do that at all, and hopefully we won't have to. That's a very big step. It's a step we can take, but we have not decided to do it. Jennifer, go.
Mr. President, two things, one on airlines and one on
Yes.
Jeff Bezos. Can you talk a little bit specifically about what you'd like to do to help the airlines, first of all? And then second of all, we heard that Jeff Bezos has been in contact with the White House daily. Can you say what he's been asking for or proposing?
Well, I've heard that's true. I don't know that for a fact, but I know that some of my people have, as I understand it, been dealing with them or with him, and that's nice. We've had tremendous support from a lot of people that can help, and I believe he was one of them. As far as the airlines are concerned, the airlines, we're going to back the airlines 100%. It's not their fault. It's nobody's fault unless you go to the original source, but it's nobody's fault. And we're going to be in a position to help the airlines very much. We've told the airlines we're going to help them.
They want $25 billion.
Well, we're going to be helping. We're going to be backstopping the airlines. We're going to be helping them very much, John. It's very important.
What do you do about the stock market, sir?
$25 billion for the passenger carriers and $4 billion for cargo?
We're going to be looking at it very strongly. We have to back the airlines. It's not their fault. In fact, they were having a record season. Everybody was. They were having record seasons, and then this came out, and it came out from nowhere. So not their fault, but we're going to be backing the airline, yeah.
Stocks continue to fall today. Would the White House support negative rates?
Best thing I can do for the stock market is we have to get through this crisis. That's what I can do. That's the best thing we can do. That's what I think about. Once this virus is gone, I think you're going to have a stock market like nobody's ever seen before.
People be voting tomorrow, Mr. President?
Mr. President, the other day you said you don't take
He'll be back in a second. He'll be back in a second. I think the question that I think maybe John asked about until July, the guidelines are a 15-day trial guideline to be reconsidering. It isn't that these guidelines are now going to be in effect until July. What the president was saying is that the trajectory of the outbreak may go till then. Make sure we don't think that these is solid in stone till July. Yeah.
That would be the outside number. Yeah.
Mr. President, you've been criticized.
Hold on 1 second, please. Go ahead.
Follow up, Senate Republicans, do you want Senate Republicans to change the package that passed the House last week, even though you
I think they
weren't
may make it even better. Look, they're working together very well with the House. They're working very much in unison, like the question before. They're working to only enhance it and make it better and make it fair for everybody, and that's what we're looking to do. So we may go back and forth with the House a little bit, but both will be in a very positive fashion. Please.
Yeah, Mr. President, these new guidelines say avoid social gatherings in groups of more than 10 people. The CDC's recommendations yesterday were for people to avoid gatherings of more than 50 people. What's evolved in you and your team's thinking in just the past 24 hours? And also, what exactly do you need to see in a stimulus?
Well, let me just have the professionals answer that. Would you like to do that?
Great. Thank you, and thank you for that question. So we have been working on models day and night around the globe to really predict, because some countries in our very early stage, like the United States, we've been working with groups in the United Kingdom. So we had new information coming out from a model, and what had the biggest impact in the model is social distancing, small groups, not going in public in large groups. But the most important thing was if one person in the household became infected, the whole household self-quarantine for 14 days, because that stops 100% of the transmission outside of the household. And as we talked about early on, it's silent. We had another silent epidemic, HIV. And I just want to recognize the HIV epidemic was solved by the community, the HIV advocates and activists who stood up when no one was listening and got everyone's attention. We're asking that same sense of community to come together and stand up against this virus. And if everybody in America does what we ask for over the next 15 days, we will see a dramatic difference, and we won't have to worry about the ventilators, and we won't have to worry about the ICU beds, because we won't have our elderly and our people at the greatest risk having to be hospitalized.
PPE, Dr. Burks, can we ask you to comment on the equipment? Doctor?
Go ahead. Yes, Mike, please.
Thank you, Mr. President. Very productive call today with governors. We talked about the new rollout of testing that we described yesterday, and drive-through and community-based testing. And I know how grateful the President is for the efforts that governors are making, and now with the Admiral and the United States Public Health Service as well as FEMA, we made great progress today in coordinating those efforts. But the other issue that was raised with the President today was personal protective equipment. And the reason I mentioned testing is because one of the recommendations that we have for states is that these remote testing sites make a priority of two groups. One would be people over the age of 65 that have symptoms. We don't want them to go to hospitals or emergency rooms. We want them to go to a remote site in a parking lot or at an isolated community location. But the other category is our healthcare workers. We want to make sure that our healthcare workers have the opportunity to be tested, and using that new high-throughput test that the President arranged with our major commercial labs, we'll be able to do that much more expeditiously. So we're putting a real priority on our extraordinary healthcare workers that are at this very hour coming alongside people that are struggling with the coronavirus and people that are concerned that they may have been exposed. The other piece is we're grateful that the legislation passed by the House of Representatives includes liability protection for N95 masks produced by companies like 3M in Minnesota, by Honeywell. Literally tens of millions of masks are produced every year for industrial purposes, for construction. But the health experts say they can be used just as readily to protect healthcare workers from respiratory ailments. 3M and other companies were not able to sell those to hospitals, but the President negotiated with the Democratic leadership of the House and Senate. We've added a provision to the bill that will literally, from one company alone, add another 30 million masks per month back to the marketplace. We're strengthening the supply chain, and healthcare workers around America can be absolutely certain that the President and our entire team are going to continue to put the health of America first and put first our healthcare workers across this country that are meeting the needs of the people of our country.
Mr. Vice President, how many test kits have been sent out, and how many people can actually be tested?
I think the Admiral can answer that. And you might want to talk about the roving also.
So thank you very much for that. As we talked about yesterday, we're really entering a new phase of testing. At first, we were at the initial phase where the CDC-developed test was only available in public health laboratories in the CDC. Works very well for a few thousand tests per day after it gets running. We're now moving into a phase that the big commercial laboratories with high throughput screening have availability. So as we talked about last week, because of the historic efforts of the FDA, a Roche test and, as the President predicted, a Thermo Fisher test were both produced last week under an emergency use authorization. 1.9 million of those tests will be sequentially into the ecosystem this week. From the information we have right now, 1 million tests are available with all the reagents, everything ready to go, primarily at the reference labs called Quest, LabCorp, and a couple others. Now, it doesn't matter if they're not in your neighborhood, because every day when people get tests, a little white box goes out in front, it gets shipped by an incredible distribution system. The test resulted and it's electronically reported. So these are available to people nationwide. We expect more and more than 1 million coming on board this week as the reagents come up and as people with the testing capacity validate that in their own hospitals and other places. And in the future, we expect at least 2 million next week and at least 5 million the week thereafter. There are also a whole growth of what's called laboratory determined testing or laboratory-derived testing, where individual laboratories, because of the regulatory deregulation of the FDA, can develop their own tests and start using them. So if you're a CLIA-certified lab with complexity, you can do that. So the point is, testing is now entering sort of what we normally do in the healthcare system, where big labs in a high-throughput basis receive these through normal channels. So that part of it is really underway.
Do you know how many Americans have actually been tested? Do you have a number?
There is a number. I don't have that number because I've been working on setting up this distribution system. So this is where we are. The state and public health laboratories in the CDC are published every day on the CDC website. The CDC gets feeds from LabCorp and Quest, and they get that on a daily basis. What is not being received right now, and Ambassador Birx is fixing, is that these homegrown tests in highly complex labs don't necessarily get reported in the system. However, as we move forward, particularly in the commercial phase of where we are right now, we expect about 80 to 85% of the tests to flow right into the CDC. We know them. That's not good enough for Ambassador Birx. She wants 100, and we'll work on that.
Sir, are you
So I think just to put it a different way, a lot of testing has been going on, and I don't believe anybody's been able to do what we're doing and what we will be doing.
And let me just say that we talked about the drive-through testing yesterday. I want it to be clear to everybody, this is just another tool for states and local public health systems and healthcare systems to use. It's not replacing testing that goes on in a doctor's office or in a hospital, or if you go to your doctor and wants to get tested in that office. This is just another tool that we're helping the states to have. And again, as we talked about, this is modeled on the FEMA-based points of distribution system optimized for testing. We expect this week, we now have gear, people being shipped right now today that will be in over 12 states with multiple sites, many of states having multiple sites, to start augmenting the local capacity and really providing the state and the local people what they need as another way for people to get tested.
So this has never been done before. That's never been done, and certainly not on a level like that. And I will say that I think I can speak for the professionals that if you don't have the symptoms, if your doctor doesn't think you need it, don't get the test. Don't get the test. I think it's very important. Not everybody should run out and get the test. That's right. But we're able to handle tremendous numbers of people. John?
Mr. President, earlier today, Governor Cuomo of New York said that he believes that hospital capacity soon will be overwhelmed and implored you to call on the Army Corps of Engineers to build temporary facilities to house patients. Is that something
we're looking into it? We've heard that. We've heard it from really two places. There are two places that have specifically, New York being one, and we are looking into it very strongly. Yeah.
Steve, go ahead. Sir, how have you changed your own behavior to take account of this virus? Are you washing your hands more?
Oh, I've always washed my hands a lot. I wash my hands a lot, probably, maybe if anything more, certainly not less.
What was it like taking the test?
Not something I want to do every day. I can tell you that. It's it's a little bit of good doctors in the White House, but it's a test. It's a test. It's a medical test. Nothing pleasant about it.
You had said that in a tweet that Governor Cuomo should be doing more.
I think he can do more.
What specifically should he be doing?
I think he can do more. And, it's an area of the country that's very hot right now. I think New Rochelle, and a place I know very well. I grew up right near New Rochelle. I think it's an area that has to be tamped down even more because it's a hotbed. There's no question about it. So I think they can look at doing it. But we're getting along very well. We've had a very, in fact, I noticed you made some statements just now that the relationship with the federal government has been good. The federal government has done everything they've wanted us to do. But we can I think it's very important that all of the governors get along very well with us and that we get along with the governors, and I think that's happening.
Mr. President, the defense secretary and the assistant defense secretary have decided to separate and be in a bubble to avoid the spread of the disease and to protect the chain of command. Is that something you and the vice president should be doing? And has there been any talk about having to have a 25th Amendment
Well, we
procedure
haven't
in
thought
place?
of it, but I will say this, that we're very careful. We're very careful with being together. Even the people behind me they've been very strongly tested. I've been very strongly tested, and we have to be very careful. But everybody should be vigilant. We have to be vigilant. Yeah,
Thank you, Mr. President. Two simple questions for you, Mr. President.
Go ahead, please.
Two simple questions for you, Mr. President.
Hold it before you.
Okay. I don't know if this is a question for you or for Dr. Burks, but Dr. Burks said that it is the millennials who are going to lead us through this, and that now is the time to look out for the older people in our home. Older might be a state of mind, not necessarily an age. So for those millennials of us who have parents who are in their 50s, 60s, 70s, what is older? What should we tell them at this point?
Well, if I was Dr. Fauci, I would tell you there's a physiologic age and a numerical age. So older people with pre-existing conditions. And what do we mean by that? Significant heart disease, significant kidney disease, significant lung disease, any immunosuppression, any recent treatment for cancer, any of those pieces in any household. Now, why do I think the millennials are the key? Because they're the ones that are out and about. And they're the most likely to be in social gatherings. And they're the most likely to be the least symptomatic. And I think we've always heard about the greatest generation. We're protecting the greatest generation right now and the children of the greatest generation. And I think the millennials can help us tremendously by having, plus they need to communicate with each other. Public health people like myself don't always come out with compelling and exciting messages that a 25 to 35-year-old may find interesting and something they will take to heart. But millennials can speak to one another about how important it is in this moment to protect all of the people. Now, you could be 40 and have a significant medical condition and be of substantial risk. You could be 30 and having come through Hodgkin's disease or non-Hodgkin's lymphoma and be of a significant risk. So there are risk groups in every age group, but there's more millennials now than any other cohort, and they can help us at this moment.
Mr. President, thank you very much. Thank you very much, Mr. President. You already talked. Mr. President, the other day you said that you were not responsible for the testing shortfall. Very simple question. Does the buck stop with you? And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. And it started with the fact that we kept a very highly infected country, despite all of even the professionals saying, no, it's too early to do that. We were very, very early with respect to China. And we would have a whole different situation in this country if we didn't do that. I would rate it I would rate ourselves and the professionals. I think the professionals have done a fantastic job. As far as the testing, you heard the Admiral. I think the testing that we've done, we really took over an obsolete system, or put it maybe in a different way, a system that wasn't meant to do anything like this. We took it over, and we're doing something that's never been done in this country. And I think that we are doing very well. We took the system, we worked with the system we had, and we broke down the system purposely. We broke it down in order to do what we're doing now. And within a short period of time, and even now, we're testing tremendous numbers of people. And ultimately, you're saying it will be what? It will be up to how many people will we be able to test?
We certainly expect with the high throughput testing that's no longer a barrier. The barrier is actually doing the test on a person, and I'm sure, as the President would inform you, in order to do the test, a healthcare provider needs to dress in full personal protective equipment. And there's a swab that's put in the back of the nose all the way to the back of the throat. It's called a nasopharyngeal swab, which is then put in media. The next person who has to get tested, that healthcare provider has to change all the personal protective equipment. When you put that in, it's highly likely a person coughs or sneezes, so you're at risk. So that's what we're trying to fix now by the mobile platforms, by all the things we're doing, is to enable sort of high throughput of this swabbing. And we're doing some technological things too that might be breakthroughs to make it much faster. But we certainly expect that from thousands of people per day, we will.
Breaking news on News 4.
Good afternoon, everyone. I'm Tracy Cornett. The president just wrapping up an update on how the country is responding and handling the coronavirus. But Governor Bill Lee also about to speak to our state's response to the coronavirus pandemic. Let's go ahead and listen in.
Over at least the next 4 days in an effort to get information out there. One of the most valuable things that we can do is provide as much information as possible to Tennesseans so that we can work together to help mitigate the spread of this disease. As of today, we have 52 confirmed cases in Tennessee, and we are working hard to disseminate guidance that's up to date and consistent with the COVID-19 epidemic across the country. It's difficult to disseminate guidance that changes rapidly, but we will provide information as soon as we get changes. The CDC is recommending, for example, no more than 50 people in a gathering, and President Trump just announced in the last hour that their guidance is no more than 10 people in a gathering, which we will begin to suggest as well. But information changes that rapidly, and that's the reason we want to continue to provide information as soon as we can. Today, I want to talk primarily about the three things that we know most about right now that most affect Tennesseans, and that is schools and school closures, testing, and then the future of our efforts with regard to our budget and our updated budget and the legislative process. This morning, we announced a decision to urge all counties to close schools over the next several days as works with their schedule. The number one driver in that decision was the safety of our children and of Tennesseans. The increased awareness that social contact with people in close proximity to one another has driven that decision to close schools. We also know that, and we'll be closing those schools till March 31st, and then we will assess where we are at that point and make further, and give further guidance to the schools. We know that closing a school has a significant impact on families all across Tennessee. It's very important that we work very hard now that we've made this decision to have schools closed, that we work to minimize the amount of impact that has on families. To that end, we are working directly with the federal government, and our Department of Education is working directly with the federal government to make sure that we receive waivers, and we have given assurances that we'll have those waivers that allow our low-income students to continue to receive meals as they would be if they were going to school. So we want to assure families that when a school closes, if their children qualified for lunch in that school, then they will continue to receive those lunches. And we will be distributing those lunches to those families in, it's undefined yet exactly how that will happen. Some districts are already doing it and providing a model for that, but we will provide food for students when their schools close. And then other changes that occur as a result of school closures we'll be looking at in the days ahead. The most important thing was to get the schools closed and to make sure the students were fed, and then we'll begin to look at next steps regarding all that needs to be done because of closing schools. And let me just say one thing here about school closures and about the need for Tennesseans to engage in their communities. We saw over the last several weeks how Tennesseans came together to help their neighbors when a tornado came. What's about to happen across schools, across this state, is that schools will close. Students who have no child care will be returning home Parents who have jobs that will require them to be out of the home will be facing dilemmas, and hardships for families will immediately take place when schools close. I'm urging Tennesseans to step up in their communities and to be a part of the solution. Yes, we will pursue funding, we will pursue relief. It's a part of what we're doing in adjusting our budget. But what we really need are Tennesseans to step up and engage. If you're a church, you need to consider adopting a school. If you're a family that has an opportunity to keep a kid for a neighbor whose parents both work, you ought to consider helping that family through the time of transition. Tennesseans can do this. This is what we're made for. And I encourage Tennesseans to take this example to serve their neighbors, as well as many other examples that will be presented in the weeks and months ahead as we deal with this crisis across our state. As we assess the major public health implications of COVID-19, I am very encouraged about the access to testing that has become available in our state. We have worked very hard in the last couple of weeks to pursue the increase of available testing for Tennesseans. The more folks can get tested, the more likely it is that we will slow the spread of this disease. We have worked with the private sector through and with our public health department to increase the amount of testing available and the sites with which people can be tested. So there's a lot of talk about drive-through testing, and that looks different in different locations, but what we're really talking about is remote testing that provides access for people who otherwise would have to go into a hospital or a health facility to be tested. I'm pleased to announce today that we have currently planned 15 remote assessment sites that will be up and operating across our 6 major metropolitan areas by the end of the week. Some of those sites are already open. I was on a call with the White House and other governors today, and it's our understanding that millions of available tests will be distributed throughout the country over the next week or 2 weeks. Beginning today and ramping up over the next 2 weeks. We currently have the capacity to test thousands a day in Tennessee now, so we have sufficient tests for the people that are presenting themselves to be tested. And now we are delivering and we are bringing online remote testing sites from one end of the state to the other. While testing capacity has expanded, however, and while we know that we have sufficient testing to meet the needs of the folks that present today, I want to call on the healthcare community broadly to be a part of this effort that we believe is so important to get people tested across Tennessee. The healthcare community must be vigilant about assessing patients who need it. And I urge physicians, I urge urgent care clinics, I urge every rural hospital and every urban hospital, every provider of health care to not turn away any patient who presents themselves with a willingness to be tested, to be assessed to determine if they need a test. We do not want anyone in this state who has a need to be tested and who qualifies for testing to be turned away for any reason. And I want to say to anyone in this state, there is a public health clinic in every county in Tennessee. And that public health clinic will provide guidance and or testing for you if you go to that clinic as a result of symptoms or contact with someone who has tested positive. Now, it's important to say that everyone in Tennessee doesn't need to get a test. And we don't need to go flood the system if we do not have any reason to really legitimately believe that we have symptoms or that we have been in close contact with someone who does have the virus. But if those things are true, you should, number one, call your healthcare provider, call your doctor. Let your doctor advise you on the quickest way to get that test done. Call the local clinic in your area or call the public health department in your county, and you will get a test. And let me say this as well. Let every Tennessean know that we don't want anything to hinder them from access to testing. If you are uninsured, you can present at any public health facility in the state of Tennessee, in any county, and you'll receive COVID-19 testing at no cost if you qualify for testing. So we don't want there to be any reason that people who need to be tested do not get tested, or that there is a bottleneck that keeps them from being tested. This will be important for the healthcare community to remember. It'll be important for Tennesseans to remember, and we're going to work hard to make sure that if people believe they need to be tested, they will be. I want to shift from mitigation efforts before I let Dr. Piercy speak, and then of course we'll have questions. But I want to address the announcement that was made earlier that the legislature will be acting on our accelerated budget presentation. So we have an obligation to pass a balanced budget. In fact, in part, in order for us to have the funds necessary to provide relief for those who will need it most over the next few months. To that end, our administration will present a budget in the next 2 days. We are working around the clock right now to adjust the budget that we presented earlier in the year. We certainly know that the economic conditions have changed dramatically in the last few days. Forecasts for growth, forecasts for the future economy of our country have changed dramatically. And therefore, we have a responsibility to adjust as well in state government. So we are making those adjustments. We are assessing those forecasts, and we will be presenting an updated budget in the next couple of days. The goal is to have that done by Wednesday so the legislature can review that budget and pass a balanced budget according to our state constitution. That will be important, as I said earlier, to provide not only for funding state government, but for funding the relief efforts that we see that will be coming in the future. We are encouraged about the efforts that we have made and about the progress that's being made and about our partnership with the private sector providers that are providing remote testing. We're encouraged by the way Tennesseans are coming together to address this challenge, but we have much before us. And we will be talking about all that is before us on a regular basis. As I said, we'll have briefings every day for at least the next 4 days, and then into the future. I want Dr. Piercy to make a few comments as the head of our Department of Health, and then we'll open it up in a few minutes for further questions. Dr. Piercy.
Thank you, Governor Lee. I appreciate the information about testing, and I wanted to add a little more detail to that. As you have heard already, the more tests we have, the more positives we will get. Don't let that alarm you. Just know that that's coming. We have just put out our numbers for today. Our numbers for today are 52, and you will notice that the majority of those are still in urban areas, Davidson and Williamson. That does not mean that the rural parts and other urban parts of our state can slack off in any manner in social distancing. I do want to applaud both Metro Nashville as well as the health systems in Nashville for the swift and thorough response they have had over the last few days as this case count has grown in these areas. You will also see on our website that starting just a few minutes ago, we are now reporting cases by age range. We are doing that in segments to identify trends that might be in certain age groups. You will also notice that those numbers don't add up yet, and we are posting the ones that we have age data on. So as soon as we get that information, we will update the website. We currently have not seen any specific trends, but we are monitoring for those in every aspect. Finally, I wanted to drive home the point about anyone who needs the test can get the test. But who needs the test? Symptoms are fever, cough, and shortness of breath. Or if you're feeling ill and have been directly exposed to someone with COVID-19, you are the ones who qualify for the test. We want to prioritize our test for our healthcare workers and our older Tennesseans, 65 and older. So I want to set that expectation that if you have sniffles or mild symptoms and you go for testing, you might not meet the screening criteria. That doesn't mean that we have a shortage of them. It means we are using those judiciously so we can test the people who need it. Thank you for what you're doing. Thank you for the coverage that you're providing to this ever-changing experience. And we're happy to take questions.
Well, we've actually been pursuing ventilators ourselves. We're going to pursue every effort, and we have we've set up a place in our office to be in constant communication with the federal government for any funding, any relief that they provide, and that changes daily. So we're accessing that constantly, but we started weeks ago planning for this coming to our state, recognizing that there may be shortages, there may be difficulties, there may be a need to pursue equipment like ventilators, and we've actually worked together with our private providers. Dr. Long, who represents the Tennessee Hospital Association, is on our task force, but she also has been meeting regularly with us about how it is that individual hospitals can pursue equipment. We've also tasked our Tennessee Emergency Management Agency, TEMA, with pursuing personal protective equipment and masks and all the types of equipment that will be necessary to do more testing and to provide adequate care for those who may contract the disease. TEMA is working with us for procurement of that as well. So there's a number of agencies and organizations that we began working together to procure that which is needed. Yes, sir, Andy. So remote testing facilities are looking a lot of different ways. Some of them will be very temporary testing facilities, tents in a parking lot that are equipped to appropriately provide safety, public safety, and provide testing at the same time. However, many of our private providers are actually employing facilities, brick and mortar facilities, a walk-in space that may be in an existing facility that they've procured for this use, but it will be dedicated entirely to COVID-19 testing and anywhere in between. But the point is that there will be remote specifically designated for testing and equipped as such, either from the Department of Health or from private providers. And yes, we have talked with the National Guard and are having our conversation, our National Guard have conversations with those private providers to provide assistance if necessary. We also have medical personnel within the National Guard that we want to utilize as these testing centers ramp up.
I have two questions for you. The first one, going back to education, the Tennessee Education Association is calling for the administration to cancel all Tennessee-ready testing. They don't believe the teachers or the parents are going to be, the teachers or the students are going to be ready. Thoughts about that? I mean, is that something you're considering at this point?
Well, what I said earlier was today we announced closures because that's the most urgent need. And we announced our strategy for food distribution because that is an immediate and urgent need. But there are a number of things that will have to be addressed. Testing, assessments, minimum day requirements. There are funding associated with numbers of days that schools are in session and the varying numbers that multiple districts will have based on who closed when. So those are all very important issues that will have to be addressed, and we are actually in the process on every one of those, but we don't have finality to those yet, but we will in the days ahead.
My second question, it's about your statement this morning. You were encouraging schools to close, but you're not mandating them to close. I wonder, why are you choosing to encourage them and doing it as a suggestion and not as an executive order or a mandate?
Yeah, you know, every school district is different. It's why some had closed earlier than others. There are varying circumstances in industries, school districts, counties, regions, and statewide mandates are not as effective as encouraging behavior. I mean, Tennesseans are going to have to come together to make this happen. They're not going to come together because we force behavior in every household, right? This is something that we need the public to weigh into and to come alongside our guidance and our suggestions. We believe that every school district will close as a result of that suggestion, and we believe that in the spirit of bringing people together to actually have more involvement, we'll do that through encouragement and through admonition and through strong suggestions. Yes, sir.
Your counterparts in other states have done some significant measures, including calling for bars and restaurants to close. Are you considering something like that? What do you think of Mayor Cooper's announcement?
Well, I think that when we're facing and when we're looking at science that shows that we should try not to gather in spaces of 10 or more, then a crowded bar certainly is not a good idea. It should not be something that people pursue. Tennesseans don't need to be going to bars that are filled with people and that put folks in close proximity. And so I would suggest the very same thing to any environment that is going to put people in close proximity that's not crucial.
Does the state have any projections whether how many people might be, tested positive or infected by this, and have there been any fatalities that we know of?
Dr. Piercy, or either, yes. Do either of you have information, ways to answer that question? I don't have that data, so if you do.
Yeah, my name is Dr. John Dunn, state epidemiologist. We are working with different colleagues to look at modeling. There's some information that's about out there currently. Some of the best information we have, of course, is from the data from other countries and from jurisdictions in our country that are ahead of us.
And what's that indicating right now?
I said we're working on that. We don't have any firm numbers. No.
Well, the mayor's obviously the jurisdiction with which the public health officials made a edict to close those bars requires Metro to enforce those. But certainly, we hope that as this unfolds, there won't be a need for enforcement of Tennesseans to comply with keeping people in our state from dying. This is not something that people should be deciding their behavior based on whether or not they're concerned about contracting the disease themselves. Every person that contracts this disease, whether they're concerned about it for their own personal health, they are risking the lives of other people. And that's the message that we want to remind people. You may not have as much personal concern as others about contracting this disease, but people go with the disease undetected for days, making contact with dozens, potentially dozens of people, many of who could be elderly or making contact with someone who will be in contact with the elderly. We have vulnerable populations whose lives are truly at risk if our behavior in this state is not responsible. And so we implore folks to take responsible actions.
Maybe we're not in this, part of the spectrum yet, but for Tennesseans that might even lose their job or they won't get to work because something's closed or whatever, what can the state do, and are you at the point where you are considering the need to do so?
Well, certainly the state has, for example, unemployment benefits that we will look at to make certain that the reserves are appropriate to provide unemployment insurance for those who qualify for that. We will be announcing, once we clarify what those are, we will be announcing specifics around requirements with regard to TANF funds, for example, needy assistance for needy families. We're looking to loosen the restrictions around those requirements so that folks have more readily accessible, that have more ready access to those funds potentially. None of those are all things we're working on. We're not prepared to announce those yet, but we recognize it's going to come as a great financial hardship to many people. And we want to develop opportunities to help provide relief for Tennesseans of all sorts, not just medical, but also financial. And recognizing, of course, there's a limit to what the government can do. It's one of the reasons that we call upon Tennesseans to assist their neighbors where they can. It'll require effort for all of us.
Governor, how long do you feel like, once the legislature recesses, how long will they be out? And will they be declaring sine die or just taking a break?
Yeah, those are questions that the legislature, the General Assembly will decide, and their speakers. Our role in that is to provide a budget so that they can then make decisions about how quickly they can act on that budget and what the subsequent subsequent meeting looks like. Yes, ma'am. But we don't know how many days. Let me yeah. There hasn't been guidance around that. We'll pursue guidance on that. We're working to look at how we can provide funding for daycare as there's more of a requirement for that as schools close. That will take some time, of course, and there is a significant federal funding package that we've all heard about that has to make its way through Congress in order for that spending and those funds to be available to states. We believe there will be significant relief from federal government, anywhere from TennCare dollars to TANF dollars, but it's not clear what those numbers will look like, but we're staying in constant contact to make sure we know what those are. You want to?
At this point, we're going to open it up to folks on the phone. If I could remind you to please state your name and your outlet before asking your question, and then as well for our speakers to restate the question before answering. All right, seeing none on the phone, we'll have room for a couple more
Yeah,
questions.
that's fine. How about some who haven't asked yet? Yes.
You're talking about relief like unemployment. There are a lot of musicians, especially in Nashville, whose tours have been canceled. Bartenders, waitresses who live on tips. Can you think of any way that they might be able to make across income?
Well, again, the implications of this financial halt we're just starting to see. And there will be a lot of folks that find themselves in difficult situations. We will expand our opportunity for serving those who are in need, whether it's the uninsured, and we are looking at strengthening our budget to provide safety care funding for the uninsured. We don't know. That's one of the things we're considering. Funding for TennCare, funding for testing for everyone that is uninsured, strengthening our unemployment benefit, unemployment insurance benefit. There are a number of ways that we can provide safety nets for people, but this economic downturn that has hit immediately and hard will have strong ramifications for many people. We recognize that, and we hope that this will be short-lived. And let me just say this. This is one of the reasons that we have to work so hard to slow the spread of this disease. Because if we can arrest this or certainly mitigate it to a degree that it doesn't have an overburdening effect on our healthcare system, if we can address this in a meaningful way, we soften the financial blow to the economy of this country. It's why it matters that people wash their hands and stay home if they're sick and don't go out if they don't have to and don't go to a bar, a crowded bar, and do all of those things that everyone is reminding us to do. It's why this is so important, because people's lives and livelihoods will be profoundly impacted based on how every single Tennessean responds to this. Sam, you started to ask.
I'm just curious, Dr. Pearson, you know if the hospitals, if we have enough beds across the state to handle the potential number of patients, and do you have any idea where these testing sites will be in Memphis?
So to answer your first question, we have a system in the state called HRTS, HRTS, Health Resource Tracking System, and that's been something that's been stood up for quite some time, several years. And so we know exactly where our beds are, what our bed capacity is, including ICUs and including ventilators. At this point, we don't have any shortage, but as Dr. Dunn has said, we don't know what the rates will be, and that's the entire point, as the governor just mentioned, about flattening the curve. That line, when you see the chart on flattening the curve, that horizontal line is the threshold of where our health system anywhere can tolerate the influx. And so by spreading out and slowing down number of new cases, our health system is able to keep up better. As far as Memphis, I am not privy to the exact location yet.
Before I will take last question.
Last week you talked about how the state was going to use those $10 million from the CDC to use them to telemedicine. I'm wondering if you can explain, the status of that telemedicine project right now. And last week you guys said it was ready.
Yes, thank you. We are awaiting continued guidance from the from our federal partners about that $10 million that's coming through the CDC. That will also be supplemented by the $8.3 billion package that's currently being considered and ultimately approved. So telehealth is a really important component of that, because not only does that increase access, but it keeps people in their homes and away from others during this very crucial time. So as has been mentioned, we've got lots of things coming at us right now, but that one is certainly high on our priority list. We would like to have something by the first of the week.
Just one final question. I'm clear on the remote sites, 15 across the state, they will be up when?
Well, do you want to address some are up?
If I'm remembering correctly, I know we have 11 operational today. and then plans in the next 3 to 5 days to stand up more. And then even beyond that 15, we've got partners working on those as needed. You know, as you can imagine, we don't want to deploy resources before we need them, but we want to make access points available.
And this they will take, each remote site is going to be a little different from the number of people they can test, but I presume they're going to be in population centers across Tennessee.
Yes, sir. That's why most of them are in the metro areas right now. That does not mean that we don't need them in the rural areas, but right now that's where the population is, and that's statistically where we're most likely to find cases. We're also talking with our EMA partners about how to address testing in rural areas if and when that becomes an issue.
Thank you, everyone.
Let me just make a closing remark. Thank you for being here today. We will do this every day. We want information to flow as rapidly as possible, and we believe that the more Tennesseans are reminded of their individual role, the more likely it is that we can slow the spread of this disease. People's lives are depending on it, and their livelihoods are depending on it, and I believe Tennesseans can do that. I encourage Tennesseans as well. Pray for our state, pray for its citizenry, that we will have wisdom and discernment in the days ahead to make the decisions that will save people's lives and that will mitigate the spread of this disease in our state. Thank you very much. We will talk again to you tomorrow.
Hi, everybody. You've been listening to this news conference here. Governor Bill Lee and health professionals giving us the latest number and a lay of the land as to what they are doing, focusing on 3 main categories: school